Hello guys, welcome to the second episode of Cardiology series by AMCStudyHub. So today we are discussing about MS, Mitral Valve Stenosis. This is also one of the high yield topic in AMC examination, repeated multiple times. So here are the key things that you must remember about the Mitral Valve Stenosis. So before moving into the topic exactly, let me tell you where is the mitral valve located. So as we all know, we have right atrium, right ventricle. In between we have tricuspid valve. And we have left atrium, left ventricle. In between we have bicuspid valve. It is just another name of bicuspid valve. Mitral valve is also the bicuspid valve. Both are same. So we are just giving another name for the bicuspid valve called mitral valve. Okay. Now mitral valve stenosis. Stenosis is a medical term. The layman term for stenosis is narrowing. So now you can make it out. Mitral valve stenosis is nothing but the narrowing of the mitral valve, which is located between left atrium and left ventricle. So just imagine if this vessel or this valve is narrowed, what happens? The blood flow usually that must happen from left atrium to left ventricle will be blocked. Yes, so okay, it is blocked. Now what happens? Blood will be piled up or blood will be filling up the left atrium. As blood is being filled up, left atrial pressure increases. Just beside left atrium we have two valves, which is pulmonary vein. Obviously due to the pressure here in the left atrium, the blood will go into the pulmonary vein. From there it will reverse back to the lungs ultimately. What happens? We know what happens if the blood goes to the lungs. It causes pulmonary congestion, pulmonary hypertension and pulmonary edema finally. So the patient will be having shortness of breath. So see, here the patient have one symptom, fatigue and exertional dyspnea. So we must know what is exertional dyspnea, right? The term exertional dyspnea is nothing but when the patient is doing some work. Exertion is nothing but work. When the patient is doing some work, they will be having shortness of breath. Because the reason behind exertional dyspnea is when somebody is working. Imagine a patient is working hard. Okay, this patient already have mitral valve stenosis. He is working hard. Okay, so when he works, we need increased oxygen. Oxygen is supplied to the tissue by blood. Blood goes to all part by the help of heart. Heart is the motor that pumps the blood. So, when we are working, heart needs to pump more blood. Of course, heart rate increases. Cardiac output increases because heart need to pump. Right. When the heart rate is working, cardiac output is increasing. What happens? Heart needs to works lot. Heart works lot. When it works lot and the blood that is piled up in the left atrium is not going to the left ventricle, what happens? Volume of blood in the left atrium increases. Patient will be having SOB. So this is what exertional dyspnea means. So that's how when a patient is working, a patient with MS working will cause exertional dyspnea due to increased oxygen demand. So I hope I have discussed about that. So due to the cardiac workload, patient will feel fatigue also. So next thing I would like to emphasize here is orthopnea. You need to remember this particular specific thing about mitral valve stenosis, orthopnea. Before knowing how orthopnea occurs, let's look into what is orthopnea. Orthopnea is SOB, a shortness of breath, while lying in supine position. This is a special feature of mitral valve stenosis. When the patient is lying in supinated position, the patient will be having shortness of breath. Let me tell you why is it. When the patient is in supine position, what happened is that the patient lying in supinated position or flat position causes his blood to move into his heart. To be specific, imagine this is a person lying flat on a surface. So, the blood from his extremities and blood from his lower part of the body will go into his heart. So, if we are standing, due to gravity, the blood will be more in our legs, right? So, we are lying. So, due to the same gravity, all the blood will be piled up in the supinated or the straight way, and once the patient is in supine position, cardiac output increases due to increased venous return. From the legs, the blood moved towards the patient's heart, hence the venous return increases, which also increases the blood or the amount of blood, which is nothing but cardiac output of the patient will be increased. So when cardiac output increases, as I told here, it further increases the left atrial volume, which goes into the lungs again through pulmonary vein, and the patient will be manifested with shortness of breath. So shortness of breath in supine position. Okay, now we are also clear about why that happens in mitral valve stenosis. Next thing is, this mitral valve stenosis present with atrial fibrillation or in pregnancy. Okay, let's crack that. Now, mitral stenosis, MS, leads to AFib. So, okay, to tell about that, let me have a quick cardiac diagram. So, imagine this is your heart. Okay, this is right atrium, right ventricle, left atrium, left ventricle. Just imagine. Okay, the problem is here, it's narrowed. Okay, it's narrowed. The problem is there. Okay, now what you need to do is, atrial fibrillation is nothing but, okay, it's in a best understandable way, it's nothing but increased irregular heart beat. Okay, it's just a type of irregular heart rate where it's an emergency. It's not in rhythm. It's not in rhythm. It's not in rhythm. So it's not normal. It's abnormal heart rate. Okay, fine. So it's a simple way of AFib. So as we know, our conducting system of heart is starting from SA node, then AV node. AV node is placed somewhere here in between the septum. Okay, just imagine it is here in the septum. Okay, so it's here somewhere in the septum. As the left atria is getting enlarged due to the pressure. Okay, due to the pressure, atria is getting enlarged. Due to this enlargement and long-term effect, left atria will undergo remodeling of left atrium, because the left atrium will dilate. The left atrium dilates and undergo fibrosis. Fibrosis is nothing but it is a sort of tissue. Okay, the heart is a muscular organ, right? So due to this particular problem of high pressure, the heart tries to adjust by itself for a long period of time, and after a particular number of try, it can't. So it dilates first, and then dilated areas undergo fibrosis. Fibrosis is, just imagine if we have an external cut, after that it is being healed by a fibrous tissue. So that would be the texture of the left atrium. Then once fibrosed, it can't give the electrical impulse properly. Then it will lead to the failure of conducting system. Hence, conduction from SA node to AV node will not happen properly. So the patient will land with AFib. Okay, now we understood why AFib. Now let's crack why in pregnancy. To be clear, it's actually not in pregnancy. Okay, it's actually recognized or diagnosed during pregnancy. Because if you remember, there are some physiological changes in pregnancy. Remember, it's physiological, not pathological. Okay, so physiological changes in pregnancy include increased blood volume. Approximately 40 to 50% of blood volume is increased in a pregnant woman. Increased cardiac output. Of course, blood volume increases, cardiac output increases. Of course, blood volume increases, cardiac output increases, heart rate increases. So when all these increases, workload of left atrium increases. And the patient will be already an undiagnosed MS case. And when the workload suddenly increased in pregnancy, she will manifest the symptoms like fatigue, exertional dyspnea, orthopnea, etc. So that's how it is not a disease of pregnancy, but it is a disease that is mostly diagnosed during pregnancy due to increased blood volume in pregnancy. So I think I have covered the pregnancy story and AFib story. Okay, so this is also something you need to remember. It is the most common valvular complication of romantic fever. We know romantic fever caused by group A beta hemolytic streptococci. So the romantic fever, mostly the patient is affected with their heart, which is romantic heart disease. So in romantic heart disease, what is affected? Mitral valve is affected. Mitral valve is, for that we, in pathology, we also say fish mouth appearance. So it's because of some vegetation deposits and all in the mitral valve, the valve gets stenosed in romantic fever. So next is risk of thrombosis. So to explain about the risk of thrombosis, it's really easy, because wherever, remember, anywhere it is, okay, wherever blood stasis is stopping the movement, blood stasis occurs. Blood is continuously moving in our body, right? It is not stopping anywhere. So the blood is moving continuously. It's being traveled continuously. So wherever the blood stasis occurs, thrombosis occurs. Blood clots occurs. So here in left atrium, there is a huge stasis. Blood is not moving. Blood got stuck there for a long while. So what happens? Thrombus formation occurs. So this thrombus can move anywhere, blocking the pulmonary vessels if in case, causing to pulmonary embolism. It's again a medical emergency. So the treatment for this condition is warfarin. It's an anticoagulant. And this condition is diagnosed by 2D echo. So I think I have covered all the important concept of mitral valve stenosis. So this is our second part or episode 2 of cardiology series. Thank you for listening to my lectures. Please do subscribe my channel And any doubts you can always comment in the comment section. I'm ready to clarify it. And any suggestions you can tell me. Please subscribe and just press the bell icon for up-to-date information and visibility on what I post. Thank you so much.